Hello everyone, this is Dr. Mumbi. Welcome to today's review. Today we're going to look at cerebral palsy. We are going to start with a few notes where we explain a few things and then we'll start looking at exam questions. Okay, let's get started with the definition. CP is a group of permanent movement and posture disorders, number one. Number two, they are caused by non-progressive disturbances. Number three, and these disturbances happen to the brain in the developing stage or development stage. Okay, those three crucial parts. And it will affect movement, muscle control, coordination, muscle tone, reflexes, posture, and balance. Classification, you have spastic CP, which is the most common. It can be spastic hemiplegia or spastic diplegia, or it can be quadriplegia. It affects all limbs, and another point here, this one presents with increased tone, increased muscle tone, and rigidity. Then you can have the dyskinetic CP. This one is characterized by involuntary movements and fluctuating muscle tone. Then you can have ataxic CP. This one affects balance and depth perception, leading to poor coordination. Then you can have the last type, which is mixed CP. This one includes both spastic and dyskinetic features. When it comes to etiology, the causes can be divided into prenatal, perinatal, and postnatal factors. So prenatal factors: genetic mutations, infections, intrauterine exposure to toxins, and maternal health issues such as thyroid disorders and seizures. Perinatal factors: premature birth, low birth weight, birth asphyxia, complicated deliveries. Postnatal factors: severe jaundice, infections, and TBI. Clinical features: you have motor symptoms such as delayed developmental milestones, abnormal muscle tone, poor coordination and balance, spasticity, rigidity, or involuntary movements. And you can have associated conditions such as intellectual disability, seizures, visual and hearing impairments, speech and language disorders, feeding and growth difficulties. So with the associated features, they'll just depend on what part of the brain is affected. So if the part for vision is affected, then vision is going to be affected. So whatever part of the brain is affected will determine the type of associated symptoms. Diagnosis will be made after clinical assessment, so after a detailed medical history, then a physical and neurological exam and developmental screening, then imaging, including MRI and cranial ultrasound for preterm infants. So with both of these, you're looking for structural abnormalities in the brain. Then the additional tests, genetic testing, and metabolic and infectious workup. Management is multidisciplinary, and therapies include physical therapy, occupational therapy, speech therapy. Medications depend on the actual presentation. So if there's spasticity, you may give antispasticity drugs. If there's epilepsy, you may give antiepileptics, and there might be need for surgical intervention. Assistive devices may be needed, such as wheelchairs and communication devices, and preventive strategies. Prenatal care: you prevent infections and manage maternal issues. Perinatal care: avoid birth asphyxia, manage preterm births. Postnatal care: prevent infections and injuries. Okay, let's start looking at questions. Question 1. Which of the following best describes cerebral palsy? Okay, so this question is asking for the correct definition. It's rare in medicine to find a question that is asking for a definition of something, but with CP, this is a common question. Okay, so A, progressive neurodegenerative disorder affecting the spinal cord. B, a group of non-progressive motor disorders caused by brain injury during development. C, an autoimmune condition leading to muscle weakness and fatigue. D, a genetic disorder resulting in abnormal muscle tone. E, a viral infection causing brain inflammation. So remember that when you're defining CP, you say it's non-progressive. So that means that A is wrong, okay? It's not a progressive neurodegenerative disorder. That is not correct. And though genetic factors may lead to CP, and as you can see in option D, and viral infections may cause CP, infections generally, the two options are not enough, D and C. And so the two options are not enough, D and E. When you look at C, it's not an autoimmune condition. So the one that gives an accurate picture here is B, a group of non-progressive motor disorders caused by brain injury during development. So three crucial parts. They're non-progressive disorders, and these disorders will be motor in nature, and they will be as a result of brain injury that happens during development. So B is correct. Okay. Question 2. Which type of CP is characterized by muscle stiffness and rigidity? A, dyskinetic CP. B, ataxic CP. C, mixed CP. D, spastic CP. E, hypotonic CP. Okay, so stiffness and rigidity is going to be found in spastic CP. Okay, so spastic CP is also the most common, and it's the one that is characterized by increased muscle tone and stiffness. All right, question 3. What is the primary feature of dyskinetic cerebral palsy? Okay, so dyskinetic CP. A, spasticity. B, involuntary movements. C, ataxia. D, hypotonia. E, muscle rigidity. Okay, so spasticity is the one that we said is associated with increased muscle tone, stiffness, and rigidity. So with this one, with dyskinetic CP, it is associated with involuntary movements. Okay, it is associated with involuntary movements. Okay, question 4. What subtype of cerebral palsy involves problems with balance and coordination? So balance and coordination, what subtype or which subtype? A, spastic CP. B, dyskinetic CP. C, ataxic CP. D, mixed CP. E, hypotonic CP. Okay, so with this one, the one that is going to present with problems with balance and coordination is ataxic CP. Ataxic CP. Question 5. Which form of CP is most likely to present with both spasticity and involuntary movements? So both spasticity and involuntary movements. This is the mixed type. So when you look at this, A, spastic. B, dyskinetic. C, ataxic. D, mixed. E, hypotonic. This is mixed CP. Okay. Which of the following is a prenatal risk factor for CP? All right. A, premature birth. B, birth asphyxia. C, perinatal infection. D, maternal rubella infection. E, neonatal jaundice. So here you have to understand what prenatal is, and you have to classify these based on whether they are prenatal or postnatal, or actually during that time when the patient is at the hospital, the perinatal stage. So premature birth, this is perinatal. Birth asphyxia, this is perinatal. Okay. Perinatal infection, this one is even direct. Neonatal jaundice is also perinatal. So the only one here that is prenatal is maternal rubella infection. Okay, so this is the correct answer here. 7. Which perinatal factor is most strongly associated with an increased risk of CP? Okay, so perinatal. A, hyperbilirubinemia. B, birth asphyxia. C, low birth weight. D, genetic predisposition. E. Maternal age over 30. All right. So which perinatal factor? So when you look at this, the one that is going to be associated with an increased risk of CP is low birth weight. Option C, low birth weight. Okay. Question 8. Which of the following postnatal factors can lead to CP? A. Maternal diabetes. B. Severe neonatal jaundice. C. Fetal alcohol syndrome. D. Prenatal cocaine exposure. E. Maternal hypothyroidism. Okay, so when you look at these options, well, all these are postnatal, okay? Maternal diabetes, all these are postnatal, but which one is going to be associated with CP or to have an increased association with CP? So here it's severe neonatal jaundice. This one is actually associated with CP. Okay, so severe neonatal jaundice, particularly kernicterus, is the one that will cause CP. All right. A 32-week premature infant develops a severe intraventricular hemorrhage. What type of CP is this infant at highest risk of developing? So basically, the type of CP that is associated with IVH. A. Spastic hemiplegia. B. Spastic diplegia. D. Dyskinetic CP. C. Dyskinetic CP. D. Ataxic CP. E. Mixed CP. So when you look at this, the one that is commonly associated with IVH is spastic diplegia. Okay. Question 10. Which maternal condition during pregnancy is associated with an increased risk of cerebral palsy in the offspring? A. Hypothyroidism. B. Diabetes. C. Preeclampsia. D. Hyperemesis gravidarum. E. Hypertension. Okay, so when you look at these, the one that is going to pose the highest risk of cerebral palsy is preeclampsia. Okay, so preeclampsia is associated with an increased risk of CP. And this is going to be as a result of compromised placental function and fetal oxygenation. Question 11. A 2-year-old child presents with increased muscle tone in the lower extremities and seizure gait. What type of CP is most likely? Okay, so we have a 2-year-old presenting with increased muscle tone in the lower extremities and seizure gait. So which one causes increased muscle tone? A, we have spastic diplegia. B, spastic hemiplegia. C, dyskinetic CP. D, ataxic CP. E, hypotonic CP. So as I was saying, which one will cause increased muscle tone? So among these, we know that spastic CP is the one that is associated with increased muscle tone, stiffness, and rigidity. Okay. Now the question is it diplegia or hemiplegia? Notice how the question says the lower extremities, plural, and also a seizure gait. So having a seizure gait implies that both limbs are affected. Okay, so it is diplegia. All right. Question 12. A child with CP has slow writhing movements and difficulty maintaining posture. What type of CP does this suggest? A, spastic diplegia. B, spastic hemiplegia. C, dyskinetic CP. D, ataxic CP. E, hypotonic CP. So when you look at these options, we have a child with slow writhing movements and difficulty maintaining posture. So writhing movements, more like twisting movements, especially with the hands. The hands are moving in this twisting movements, slow twisting movements. This sounds like an involuntary movement. Okay, so when you manage to extract that to see that this is a presentation of involuntary movement, then it becomes easy, because then the question is which one among these presents with involuntary movements. So it becomes dyskinetic CP. Okay, so dyskinetic CP is characterized by slow writhing movements and difficulty with posture control. 13. Which of the following is not a common clinical feature of cerebral palsy? A. Seizures. B. Intellectual disability. C. Visual impairment. D. Progressive muscle weakness. E. Hearing loss. Okay, so among these, the definition itself did say that it's a non-progressive disorder. So progressive muscle weakness is the answer here. Okay. 14. A child with CP has difficulty with fine motor skills, such as picking up small objects. Which type of CP is most likely? So we have a child who is having difficulty with fine motor skills, such as picking up small objects. What type of CP are we dealing with? A. Spastic diplegia. B. Spastic quadriplegia. C. Dyskinetic CP. D. Ataxic CP. E. Hypotonic CP. Okay. So the one that will present with difficulty with fine motor skills is ataxic CP. Okay. So it presents with difficulty with fine motor skills and also balance and coordination issues. Okay. Question 15. What is a common early sign of CP in an infant? Common early sign: A. Frequent ear infections. B. Delayed motor milestones. C. Poor weight gain. D. Chronic cough. E. Diarrhea. So with CP, you're going to have delayed motor milestones and prolonged primary reflexes. So reflexes like the motor reflex are going to persist, while motor milestones are going to delay. So a child being able to sit on their own, those things may delay. So that is what happens with CP. Primary reflexes persist while motor milestones delay. Remember how primary reflexes have to disappear at some point and motor milestones have to kick in. So with CP, primary reflexes persist while motor milestones delay. Okay. Question 16. Which imaging modality is most useful for diagnosing structural brain abnormalities in CP? A. X-ray. B. Ultrasound. C. CT scan. D. MRI. E. PET scan. So with CP, you go with an MRI, and if you're dealing with preterm infants, you go with a cranial ultrasound. Okay. 17. Which of the following diagnostic tools is most commonly used to confirm CP in a young child? A. Genetic testing. B. EEG. C. MRI. D. Blood tests. E. Lumbar puncture. So it is a similar question, and here you're going with an MRI. Okay. 18. What is the role of cranial ultrasound in the diagnosis of cerebral palsy? A. Primary diagnostic tool for CP. B. Identifying brain structured abnormalities in neonates. C. Monitoring brain activity. D. Assessing cognitive function. D. Detecting genetic mutations. Okay. So with cranial ultrasound, you're using it in preterm infants, and you're basically using it to identify brain structure abnormalities. Okay. Question 19. Which of the following developmental assessments is commonly used to evaluate motor function in children suspected of having cerebral palsy? A. Denver Developmental Screening Test. B. Bailey Scales of Infant Development. C. Giselle Developmental Schedules. D. Peabody Developmental Motor Scales. E. Wechsler Intelligence Scale for Children. So with this one, it's Peabody Developmental Motor Scales. That's the one that is used. Okay. 20. At what age is cerebral palsy typically diagnosed? A. Neonatal period. B. 6 months. C. 12 months. D. 2 to 3 years. E. 5 years. Okay, so remember what I said. With CP, primary reflexes persist and motor developmental milestones delay. So you are going to diagnose this at a time where primary reflexes should have disappeared and motor milestones should have kicked in, which is usually about 2 to 3 years. Okay, so 2 to 3 years. 21. Which of the following is a common associated condition with CP? A. Autism spectrum disorder. B. Congenital heart disease. C. Epilepsy. D. Diabetes mellitus. E. Asthma. So this one is epilepsy. Question 22. Which motor milestone is often delayed in infants with cerebral palsy? Okay. A. Smiling. B. Sitting without support. C. Babbling. D. Reaching for objects. E. Social smiling. So when you look at this, sitting without support is the one that is usually associated with cerebral palsy. So you're going to find that in infants with cerebral palsy, they'll find it difficult to sit without support. And that will usually be the first thing that the mother complains about and what will make the mother to come to the hospital. There could be other things, but this is one of the most common. You have a mother is telling you, my child is 8 months, is 10 months, is 1 year, but he or she cannot sit without support, okay? Because children normally attain the ability to sit without support by 6, 7 months, somewhere there. So if you have an 8, 10, 12-month-old child who is not able to sit without support, then you're thinking that maybe something is not correct. So usually this is one of the first things that the mother would tell you about their child. Okay. 23. What is the primary reason for using MRI in the diagnosis of CP? A. To evaluate brain metabolism. B. To visualize structural abnormalities in the brain. C. To assess blood flow in the brain. D. To measure electrical activity in the brain. E. To detect neurochemical changes. Okay. So you use it to visualize structural abnormalities in the brain. Okay. Option B. 24. Which early reflex is often retained in infants with CP? A. Motor reflex. B. Sucking reflex. C. Rooting reflex. D. Asymmetrical tonic neck reflex. E. Palmar grasp reflex. Okay. So when you're looking at these reflexes, as I said, primary reflexes are usually persistent in CP. So the one that is usually retained is ATNR, asymmetric tonic neck reflex. So this is the one where the child, normally it presents by a child assuming what we would call a bow and arrow position. Okay, bow and arrow. The same position, the same posture that you would assume if you were preparing to fire a bow and arrow. So that's the one that is usually retained. Asymmetrical tonic neck reflex. Okay, so this is the one that is often retained beyond the normal age in infants with CP. 25. What is the typical clinical presentation of spastic hemiplegia in CP? Okay, typical clinical presentation of spastic hemiplegia. A. Spasticity in all 4 limbs. B. Involuntary movements in the face and limbs. C. Spasticity predominantly on one side of the body. D. Poor balance and coordination. E. Generalized hypotonia. So 2 words here. Okay. Spastic hemiplegia. It's spastic, so spasticity will be there. It's hemiplegia, it will be on one side. So spasticity predominantly on one side of the body. 26. Which of the following medications is most commonly used to reduce spasticity in cerebral palsy? So, pharmacological treatment. A. Carbamazepine. B. Baclofen. C. Risperidone. D. Prednisone. E. Metformin. Okay. So, with CP and you want to reduce spasticity, you use baclofen. Baclofen is what is used. 27. What is the main goal of physical therapy in children with cerebral palsy? Okay. Main goal. A. To improve muscle strength and function. B, to cure the underlying brain injury. C, to enhance cognitive development. D, to treat seizures. E, to prevent infections. So the correct answer is to improve muscle strength and function, option A. 28. Which surgical procedure might be considered to alleviate severe spasticity in CP? Okay, surgical procedure that may be considered to alleviate severe spasticity in CP. A, spinal fusion. B, selective dorsal rhizotomy. C, tendon release. D, deep brain stimulation. E, hemispherotomy. So with this one, the one that is considered is selective dorsal rhizotomy. So this procedure is done under general anesthesia, and it's a minimally invasive procedure which involves identifying the actual nerves or nerve roots that are responsible for the spasticity that is present, and they are carefully cut or sectioned to reduce the abnormal signals that are being sent to the muscles, and as a result, there is a reduction in spasticity. So that is the procedure. Selective dorsal rhizotomy. Notice how the term has selective. So the particular nerve roots that are responsible are the ones that are selected and separated. 29. Which of the following interventions is important for managing feeding difficulties in children with CP? Okay, so managing feeding difficulties in children with CP. A, speech therapy. B, physical therapy. C, occupational therapy. D, nutritional support. E, psychotherapy. I think this one is direct. It's nutritional support, and it's important for managing feeding difficulties. 30. What role does botulinum toxin play in the management of CP? A, it reduces seizure frequency. B, it improves cognitive function. C, it decreases spasticity in targeted muscles. D, it enhances coordination. E, it treats gastrointestinal symptoms. Okay, so here the correct answer is that it decreases spasticity in targeted muscles. Okay, it's used to decrease spasticity in targeted muscles. And I think with that, we're going to end today's review. I hope you have learned something. All the best in your preparation for your exam.